Men's hair loss, causes, treatments, and prevention. Hair loss is a common issue among men, affecting millions worldwide. While it is often perceived as a natural part of aging, hair loss can have significant psychological and emotional impacts. Understanding the causes, available treatments, and preventive measures can help men manage this condition more effectively. This video drills into a comprehensive overview of men's hair loss, exploring its types, underlying causes, treatment options, and strategies for prevention. Types of hair loss in men. Androgenetic alopecia, also known as male pattern baldness, androgenetic alopecia is the most common form of hair loss in men. It typically starts with a receding hairline and thinning at the crown, eventually leading to partial or complete baldness. Genetic predisposition and hormonal changes, particularly the effect of dihydrotestosterone, DHT, on hair follicles. Telogen effluvium, a temporary form of hair loss characterized by widespread thinning of the hair, occurs when a large number of hair follicles enter the resting telogen phase simultaneously. Stress, illness, surgery, significant weight loss, or nutritional deficiencies. Alopecia areata, an autoimmune condition where the immune system attacks hair follicles leading to patchy hair loss. Can affect any part of the body, including the scalp, beard, and eyebrows. The exact cause is unknown, but it is believed to involve genetic and environmental factors. Traction alopecia. Hair loss resulting from prolonged tension on the hair, often due to certain hairstyles like tight ponytails or braids. Repeated pulling or tension on the hair, causing damage to hair follicles. Anagen effluvium. Rapid hair loss occurring during the anagen growth phase of the hair cycle. Chemotherapy, radiation therapy, or exposure to toxic chemicals. Causes of hair loss in men. Genetic factors. Hereditary pattern. Androgenetic alopecia is primarily influenced by genetics. If a man's family members experience hair loss, he is more likely to develop the condition. Hormonal influence. DHT, a derivative of testosterone, plays a significant role in hair loss. Men with higher sensitivity to DHT are more prone to androgenetic alopecia. Hormonal changes. Aging. As men age, hormonal changes can affect hair growth. Decreased levels of testosterone and increased DHT can lead to hair thinning and loss. Conditions such as thyroid disorders, diabetes, and hormonal imbalances can contribute to hair loss. Nutritional deficiencies. Essential nutrients. Deficiencies in vitamins and minerals such as iron, zinc, vitamin D, and biotin can affect hair health and lead to hair loss. Diet and lifestyle. Poor diet, excessive alcohol consumption, and smoking can exacerbate hair loss by negatively impacting overall health. Stress and psychological factors. Physical or emotional stress can trigger telogen effluvium, leading to temporary hair loss. Chronic stress can also contribute to long-term hair thinning. Anxiety, depression, and other mental health conditions can affect hair health and exacerbate hair loss. Treatments for hair loss. Medications. Minoxidil, Rogaine. An over-the-counter topical solution that stimulates hair growth and slows hair loss. Applied directly to the scalp, minoxidil is effective for many men but requires ongoing use. Finasteride, Propecia, a prescription oral medication that reduces DHT levels, slowing hair loss and promoting hair regrowth. Finasteride is generally effective but may cause side effects such as decreased libido and erectile dysfunction. Dutasteride. Similar to finasteride, dutasteride is a more potent inhibitor of DHT and is sometimes prescribed for hair loss. Hair transplant surgery. Follicular unit transplantation, FUT, involves removing a strip of scalp from the back of the head and transplanting hair follicles to the balding areas. Leaves a linear scar but can transplant a large number of grafts in one session. Follicular unit extraction, FUE. Individual hair follicles are extracted from the donor area and transplanted to the balding areas. Less scarring than FUT and shorter recovery time, but more time-consuming and potentially more expensive. Low-level laser therapy, LLT, stimulates hair follicles, promoting hair growth. Available as in-office treatments or home-use devices like laser combs or helmets. Platelet-rich plasma, PRP, therapy. Involves injecting platelet-rich plasma derived from the patient's blood into the scalp to stimulate hair growth. Shows promise but requires multiple sessions and can be costly. Microneedling. Tiny needles create micro-injuries in the scalp, promoting hair growth through increased blood flow and collagen production. Prevention and management strategies. Healthy diet and nutrition. Ensure a diet rich in essential vitamins and minerals, such as iron, zinc, vitamin D, and biotin. Include a variety of fruits, vegetables, lean proteins, and healthy fats. Consider taking supplements if dietary intake is insufficient. Consult a healthcare provider for personalized recommendations. Practice stress-reducing activities such as yoga, meditation, deep breathing exercises, and regular physical activity. Seek support from mental health professionals if experiencing chronic stress, anxiety, or depression. Gentle hair care practices. Avoid excessive heat. Limit the use of hair dryers, straighteners, and curling irons, which can damage hair. Mild products. Use gentle shampoos and conditioners designed for your hair type. Avoid harsh chemicals and sulfates. Avoid tight hairstyles that pull on the hair. Be gentle when brushing or combing to prevent breakage. Regular scalp care. Regularly massage the scalp to increase blood circulation and promote hair growth. Keep the scalp clean and free from excess oil and dandruff, which can contribute to hair loss. Psychological impact and support. Emotional well-being. Recognize and address the emotional impact of hair loss. It's normal to feel distressed or self-conscious. Positive coping strategies. Engage in activities that boost self-esteem and confidence, such as exercise, hobbies, and socializing. Support networks. Family and friends. Seek support from loved ones who can provide emotional encouragement and understanding. Support groups. Join support groups or online communities for individuals experiencing hair loss. Sharing experiences and advice can be comforting. Consider professional counseling or therapy to address the psychological impact of hair loss and develop coping strategies. Men's hair loss is a common issue with various underlying causes, including genetics, hormonal changes, nutritional deficiencies, and stress. Understanding the types of hair loss and their causes is crucial for selecting appropriate treatments and preventive measures. Medications, surgical options, and non-surgical treatments offer solutions for managing hair loss, while a healthy lifestyle and gentle hair care practices can help prevent further hair loss. Addressing the psychological impact of hair loss through support networks and professional counseling is essential for overall well-being. By taking a comprehensive approach to hair loss, men can effectively manage this condition and maintain their confidence and quality of life. If you received value from this video, please like, subscribe, and comment.